sometimes people can feel like they get lost in the shuffle, and I never want patients to feel that way. I also give my patients my personal email address, and I don't feel like patients abuse it. Obviously, we have like a patient portal, and they know that my nurses are there to reach out to them, but I give my patients my email address. Now, not my work email address, but it's my personal email address that they get. And I really try to let them know that, like, if there's something not going quite right, because listen, we try our best, but sometimes things happen, people get confused, things happen, whatever, to reach out to me. And I think it goes a long way.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel. Welcome, everyone, to the Pinnacle Prescription Podcast. I'm your host, Dr. Rupa Wong, and today I'm joined by Dr. Allison Rodgers for Personalizing Medicine, How to Care for Patients and Manage Your Time with a Personal Touch. Dr. Rodgers is a board-certified reproductive endocrinologist practicing in Chicago. She also serves as the director of ambulatory surgery at Fertility Centers of Illinois. She has verified social media accounts with 1.2 million followers, where she focuses on getting accurate medical information out to her followers to empower them to make the best medical decisions for themselves. Dr. Rodgers' own personal experience has helped guide her to her current place, and we're going to dive deep into that. But first, thank you so much for joining us today.
Oh, thank you so much for having me, Rupa.
I can't wait to get started because you and I have never met in real life, but I feel like I know you from social. But what I don't know about you is what led you to the field of reproductive endocrinology? What drew you to fertility?
So I love problem solving. I always have. I love figuring out puzzles and problems. And I think that sort of some of the hormones and all of the like intricate problem solving you have to do in this field to try to help people get to their goals was really one of the things that drew me to it. Also, probably just like you, being a mom is my most important job. And I love being a mom. And I think that helping other people get there is one of the most rewarding things.
Absolutely. And I think that that's such a neat way that you get to experience motherhood in a different way than many of us do, and with helping create it so often. So can you share, talking about motherhood, and we were talking right before this about how we both have 3 children. Can you share how your personal experiences with secondary infertility and pregnancy loss have shaped your approach to your field, and then also to the way that you care for your patients?
Yeah. So when I was going through this, I was a fellow. And I remember my co-fellow at the time saying to me, this is going to be great for your like career and your outlook on life. And I was kind of like,
oh my gosh,
let me punch you now. But
yes, exactly.
Because I was able to be successful. And I will say I have a very unique view of sort of what my patients are going through. Now, listen, as doctors, we don't need to experience everything our patients are going through, right? If you're a cardiologist, you don't need to have a heart attack to be able to take care of people with heart attacks, right?
Absolutely.
So, but I think that compared to maybe other areas of medicine, this is a very, very emotional, charged, disease. And there's some studies showing that it's as devastating and emotional as getting a oncology or a cancer diagnosis. And so, I feel like I'm able to really understand not only sort of the medical part, but maybe the physical and the emotional, as well as the financial burden that treatment can bring. And I think that that's really where I really try to, like we probably all do, use the golden rule, try to care for people like you would want to be cared for. And I think that, as horrible of that experience was, and it was truly like one of the darkest times in my life, I like certainly emerged with the family I wanted on the other side. And it certainly has helped me be the best doctor I can be.
I think you touched on so many things that, of course, it's not necessary to go through whatever it is that your field is on, but it certainly, in your particular field, especially gives you that empathy and the nuanced perspective that some others might not have. And it is such a personal field, right? So, how do you normally build that trust and maintain a personal connection with your patients that are that are facing these challenges that are quite similar to your own? Do you share everything? Do you not? Do you just keep it professional? How do you go about that?
So, I think that I bring it up as necessary. I don't start off every new patient consult by telling patients, "Oh, I've been through this. I'll get you through this," right? But I think sort of, as patients are experiencing things, as I feel like it's socially appropriate, I certainly bring up my own story. And for people who also follow me on social media, and a lot of my patients connect with me there, which is a great way to connect, I certainly bring that up from time to time on social media as well. So they sort of know that. And I think that, one of the things is I really, just like the rest of us probably do, but I really try to get to know my patients, right? And so I sort of try to understand their goals, try to understand where they want to get to. And I think that really helps me. But I think, I don't know what percentage of patients that I talk to about it, like probably 10 to 15%, like not that much. But if it comes up, right, like if someone's talking about miscarriage or something, I'll be like, God, I know how hard it is, right? I've been there, or something like that. So, or when I talk about like IVF, I'll be like, well, I went through this, and, everyone's different, but this is, I felt this way during treatment, right? So I think that sometimes I can kind of sneak it in there, and patients realize that, like, I feel like it's that commercial. I'm not only the hair club president, but I also was a client, right? Like,
Yes.
I've also been there in your shoes.
I mean, I think that's interesting. I actually would have thought that it came up because maybe you found patients, or patients found you online, so they've seen your story. So how else do you build that trust and that connection? Especially, I mean, I went through fertility issues with my second, and it's such an emotional time. And when I went through it, so my middle son is 12. I mean, there was none of this. I mean, you weren't on social media. Nobody was talking about this out there in the world. And we kept it really quiet. Nobody knew. Like, we didn't tell our family. We didn't tell, nobody knew. And it felt like such a heavy burden.
And very similar. So I had my first one without trouble, and then I needed help with my second and third. And my second is 13. So very similar age. And I didn't tell anybody. And it wasn't until like my family was complete, many years later, that I felt comfortable being able to be open about my own journey, because it was just such an emotionally difficult place. I think that, like, just like I really try to get to know my patients. So like, those things like, they're going on a big trip, or someone in their family's sick and they bring it up, right? I add that to their note in their chart. And then, it reminds me when I see them the next time, oh, hey, how's your mom doing after that surgery? And I think that goes so long. I always try to use people's names, right? I don't like to just, I like to use, so how you doing today, Rupa? Right? Like, I like to be able to, like, make them feel like they're not just a number, because especially in the fertility community, where like people are lining up for ultrasounds and blood work, and, sometimes people can feel like they get lost in the shuffle. And I never want patients to feel that way. I also give my patients my personal email address, and I don't feel like patients abuse it. Obviously, we have like a patient portal, and, they know that my nurses are there to reach out to them. And but I give my patients my email address. Now, not my work email address, but it's my personal email address that they get. And I really try to let them know that, like, if there's something not going quite right, because listen, we try our best, but sometimes things happen, people get confused, things happen, whatever, to reach out to me. And I think it goes a long way.
Absolutely. And I think even just those small things, I do that in my office too. We have little sticky notes, and we'll put, going to Japan, or daughter just got accepted into college. And it just makes them feel a part of your community. as well. But you, I mean, you're in a bigger place, Chicago, than I am here in Hawaii. So that really probably helps them not feel like a number in that way.
Yeah.
I didn't even realize, I mean, I've been through it, but not thinking about how, from your standpoint of how many ultrasounds and how many, all the different steps that have to be undertaken for a patient to truly get to, the point where they're a mother.
Yeah. Well, and everyone's got certainly a different journey. I will also tell you that I like to, sometimes patients come in and they're getting an ultrasound with the sonographer. Maybe they've had an IUI with the nurse. Maybe they had an egg retrieval with one of my partners because I was doing procedures elsewhere that day. So I like to personally call my patients, like probably more than any doctor I know, but I call them with every pregnancy test, the first pregnancy tests. I call them if something's not looking right on ultrasounds. I call them with genetic reports, with their embryos after embryo transfers, to talk about culture. And I feel like it's a touch point where it doesn't take me a lot of time. I will say I'm the most productive doctor in my practice. And I feel like I have, out of 11 doctors, and I feel like I have the time to spend a few minutes and call the patient to let them know because they're not necessarily seeing my face, right? But I'm reviewing their ultrasounds every day, and right. I'm seeing them, but they're not seeing me. And so I think that also lets them know that, I'm keeping close tabs on everything. I'm watching everything. I'm taking them really seriously. This is really important to me, just like it's important to them. That's definitely not lost on me.
I love that. And also what you added, because as you were talking about how you call them for these different touch points, which I'm sure makes them feel cared for and that personal connection, you also added that you're the most productive member of your team. So it's not taking away from your ability to see patients or do the procedures. How are you able to balance that? Or is it just that the fact that you have anticipated this takes me an hour to do, or it doesn't even take as long as that? How do you build that into your schedule?
Okay. Right. So I leave time. So I have I see, on clinic days, I have time in the morning where I do procedures and consultations, a mix between in-person and telehealth. And then I have time in the afternoon where I review all the results from all the ultrasounds and blood work for patients in the middle of treatment. And typically I'm able to get to the calls at that point. And it's usually just a couple a day, right? It's not excessive. And if for some reason I can't get to it during that slotted time, I make a quick call after, and I don't feel like I'm not ever able to do it. So
you just knew that was important to you, but that's probably not the model for everyone. I can't remember.
I don't think so. And even we get a report of every person who has embryos in culture. So it's our fertilization report of everybody on every day of embryos in culture and what's going on with them. And even if I'm out of town, if I'm on a weekend, I'm not calling patients on weekends. If I'm not working, if I'm working, I'll call them. But if I'm not working, I'm not calling them on the weekend, but I save those emails and review them on Monday and call them on Monday. And so even the patients who are having procedures and stuff when I'm not there are still feeling that sort of touch point that, that I'm looking out for them because I'm doing it behind the scenes, but it's important to know for them to know that I'm doing it too.
Absolutely. Because if they don't recognize what you're doing, then they're going to feel like that number. And so those little things that you're making sure to incorporate the time for is helping build that trust and create that personal connection, which makes it probably very different and individual.
Yeah. And I think that individualizing, when I take a history, especially if somebody's coming back for care, I put their kids' names in there. Mm-hmm. Right. And so just what are their dogs on the televisit? What is their dog's name? Right. It's just those little things. And It's not that it's not genuine, because it's absolutely genuine.
Yes.
And it just takes a second to be her dog's name is, Puffy. And then you're oh, hi, Puffy. Right. I mean, and it makes them feel oh my gosh, she really knows me.
Totally. It's so interesting because when we do it, even then our front desk staff have access to that. So they will add things as well. And then they will ask, oh, how's Mrs. Blah, blah, blah? I know that she won a gardening competition. I don't know, whatever it is. And it makes them feel good from the beginning, I think, right?
Absolutely. Absolutely.
And I love that you said you also protect your boundaries. So you're not emailing on the weekends, you have created these time blocks to do it. And if you need to, you can push it, but you
Yeah.
are
I
still
will say
protecting.
sort of my number one task every day is patient care, certainly, and like getting back results to nurses so that nurses can get their jobs done, get like answers to patients, all that stuff. And a lot of times I check my email once a day only,
Okay. Oh, I
or
love
sometimes
that.
sometimes once every other day.
Oh, that's so good.
So like
That's
if it's something that's urgent, you need to call me.
right.
Right? Like, but if it's an email, I feel like it can wait 1 or 2 business days.
I think that that's great, because that obviously, how did you come up with that system? Was that something you saw in fellowship that your mentor did, or did you
Nope.
just realize this is what I liked as a patient and I thought it would
Oh,
enhance patient
yeah. I
care? How?
mean, from the patient care perspective, so I was with a previous practice and left that practice. I didn't train in Chicago. I had to move to a different geographic area because of restricted covenant. I wasn't allowed to talk to any of my previous referring patients or doctors. And I had to start from scratch. And when I joined my practice, even like some of the older physicians in the practice who are no longer there were, I mean, not so thrilled about me talking to the referring doctors. And so, yeah, right. And so I had to build from scratch. And when I first started at this practice a little over 10 years ago, I had I started from scratch. So I just started off, I didn't have very many patients. And so I came up with systems to touch base with the patient. So when I, have a patient has an egg retrieval, I put notes in, like reminders to myself to call them on days to check in on them. So they are sort of popping up on my list of things to do. And as I've gotten busier, I've been able to maintain that. Now, certain things I've changed, but like in general, I think it's worked really well.
I love that. I really love that a lot, because you created a system to address that need, and then it helped. I mean, I think word of mouth referrals are always going to be the best,
Absolutely.
right? And these
Absolutely.
patients are happy. Dr. Rodgers takes care of me personally. She called me, and that's the way to build a practice, I think. How did you find, though, when you're sharing all of your life and all this advice and this educational content on social media, how do you balance sharing the professional knowledge and the personal experiences? And I struggle with this too, to educate and support your followers, but then you're also making sure not to, compromise patient privacy,
Oh,
or even
absolutely.
your children's privacy, right? There's all those different layers
Yes.
of it, but it all goes to still deepening that connection, I think, with your patients.
Absolutely. So, like we said, I have 3 kids. My oldest has been doing social media with me since she was 12, and now
I
she's
love
almost
it.
17 and a half. Yeah, it's funny because we spent a lot of time talking about periods, like way before she ever got a period, which was so funny. She, with all of my children, my other 2 are younger, so they're not really on my social media a lot. But anytime I post a picture, anytime I always ask their permission.
Yes.
Because I found that I didn't think they cared, and I would post a picture and be like, I don't like that picture myself. And I would have feel bad if someone was posting pictures of me.
Yeah.
If I didn't give them permission, I didn't like the picture. So I always ask their permission for that kind of stuff. And then when patients send me cute baby pictures, which is like every day, right? And I'm always like, hey, can I share this picture? And then, they write, yes, absolutely, go ahead or can I share this picture? They say yes. I save that email. I have a folder in my email where I save it. So it's documented that they approved that I could share that. I don't put anyone's names on it. Obviously, I do a lot of sperm videos. Those are all de-identified. I don't actually even know patients' names. I just get a slide with like a different colored tape sticky on it. So I don't even know who they are. I'm just reviewing the semen analysis under the microscope. And, obviously if it's a surgical image or something like that, I always ask permission from patients. But I think that you can really educate about topics and not have it be very specific to a specific patient, right? This isn't like New England Journal Medicine, like rare cases of like only one person in the whole world has this case and we would all know who it is. I mean, this is like common topics of people wanting to learn about their bodies. How are they ovulating? When they should be having intercourse? Like all of the just general health information that we talk about all the time. For you, you're talking about eyes and eye safety and eye drops and all the things, right? That like you talk to people about all the time, and it's really just general medical information and it doesn't have to be personal. I share what I sort of feel comfortable with. I certainly don't share everything in my life. I try to actually share positive things. There's a lot of things that I don't share on social media. You don't see my husband. In fact, somebody asked me if I was married because I think your husband's kind of shyer on the shyer side too.
For sure.
But like, my husband does not want to be in social media at all. Every once in a while I can convince him to do like a selfie or something, but like that's not his thing, right? So there's a lot of things, obviously private, personal things going on in my life, that are personal and private that I don't share. I do share a lot, but I don't share everything.
Right. It's not an all access pass, which I don't think it should be either. But yes, our husbands should get together. He really doesn't. I can coerce him a little bit because I'll just, it's for the practice. And since we work together, this is, it's going to bring the PR up and you'll get more, and he's always so surprised when his 65-year-old patients tell him, I follow your wife on YouTube or Instagram, and that'll make him, okay, maybe I'll do one or two more videos with you. But yes, I think that's really important. I also always ask my children for permission because you don't know how they want to be. Maybe they don't want to wear those shoes in that picture. I don't know, whatever it is, that's it. But I think that some of the topics that you were talking about that are general, like what are the most, I don't want to say viral, but the ones that just got the most engagement, those questions on your platforms that seem to be common knowledge, but also there's so much misinformation about them. What are some examples of those that you address?
So my social media content is sort of split into two niches. So one is fertility, which is certainly like my job, my career, engaging with patients. And then I also do some just general gynecology content creation with my daughter about, periods and how to prepare for getting a period and how period products and those kind of how to shave. I mean, just the things that like you probably wish you knew when you were 11 or 12 or 13 years old that you may not have had someone to ask. So I do sort of that content as well. I think that there's a lot of, sometimes if I say something a little shocking, people are always like, whoa, because I don't have any issues saying the word vagina. I'm a gynecologist. And so, right.
Yes.
I think sometimes people are like, whoa, you said the word vagina. I know. So I do think, I do this Sperm Monday series. People love learning about sperm. People who are not trying to get pregnant, right? 50% of the population probably has sperm or at some point in their life probably had sperm or will have sperm. And they are really interested because this is something that like we're not looking at under the microscope on a regular. And so it's really very fascinating for people to sort of understand. I think there's a lot of misinformation and, myths out there about getting pregnant, ovulating, best practices for trying to conceive, those kind of things. So I think that always are things that really people appreciate understanding.
I love that because again, I think I've shared your account and several other OBGYN accounts with my nieces because I think it's so helpful. They might feel a little bit embarrassed to ask their mothers or their doctors, and it's great to get actual verified medical information and education from platforms like yours where some might not even have access, right, to those providers. So I think that that's so wonderful what you do. But it's a time suck. I think it is, at least. And I imagine you don't have some mythical, magical way of creating content, digital content that does not require time. So it's a time suck. You are very busy with your practice. You've got 3 kids. So tell me about your strategies that have helped you manage your time, balance your professional responsibilities, your personal engagement.
Yeah. So, social media for me is fun. I think it's enjoyable. I enjoy creating content, but it also takes sort of a backseat to some of the other responsibilities in my life. So when I have time, often like my daughter and I will sit and do like batch a bunch of content. So we'll sit and just answer 20 questions, and then it provides several weeks of content. And as questions come up, topics come up, I find the time, but it's definitely one of those things that sometimes if I don't have the time, it has to sort of wait till the next day. I think I have like 250 videos that just need to be edited. And someone's like, you just need to hire someone. And I'm like, oh, I don't know. Because like, I feel like I have very specific ideas about how I want to answer questions, make sure they're medically accurate, portray, cut things out, whatever. So I'm not sure, I'm not quite there yet, but I think that it's, I feel that there are sort of 4 pillars of personal well-being. This is sort of, I don't know, I just made this up. And not just now, but this is what I sort of feel like. And those 4 pillars are yourself, your spouse, your kids, and I also throw in family in there. Some people don't have kids. Some people have a lot of like family obligations, and then your career. And I think about being on like a teeter-totter with like 4 edges. And it's sunset here. It's the sun is sort of in my face. Sorry. So I feel like it's like this teeter-totter where you're like have to make sure you take care of everybody. You need to make sure you take care of yourself. You need to make sure you take care of your relationship with your spouse, spending enough time with your kids. As I have a almost senior in high school who's, a few months away from 18, like they're not with you forever. And you need to make sure that you take care of your career. And certainly like I've had times where I've had, longer term illnesses in family members or kids where I've had to like really sort of make sure I'm there to take care of them. I've had times where work becomes really demanding because of a variety of things. And I have to I feel like I'm on a bit of a teeter-totter, and sometimes it's okay. I feel like it's okay to give more of your energy and attention to one of those areas. Yes. And maybe you're struggling. Maybe you need to provide your own self-care. We were talking before we started recording that I'm a horseback rider and I ride my horse every day, except for Mondays when the grooms and the horses get the day off. And my life is set up so I can do that because it's really important to me for my physical and emotional well-being. And so that's something that I don't compromise on. So I make sure that I'm able to be there. And I think that just with all of those 4 areas of your life, being able to have grace, but also realize that at certain points in your life, one of those may take more precedence than the other.
Completely agree. It's you're never going to be able to achieve that perfect equilibrium in the center of the 4-pronged teeter-totter, right? You just can't. So it's trying to chase that.
It's not necessary.
Yes, exactly.
Right? Like, so I think that, and the needs are changing constantly. So
yeah, I totally agree with that. What advice would you give other women in medicine who want to have this kind of personal connection like you do with your patients, but then sometimes that can also feel extremely overwhelming. And then also, like we talked about, the time demands, the way that you've had to structure your time and balance all these other 4, these 3 other aspects, not just their career. So what advice do you give to them for how to do that?
One of the things that I've really learned now that I've been doing this a while is that I have limits. And so I have a leadership role in my practice. I'm one of the 3 executive officers, physicians who are sort of running the practice. And when I have been asked to take on more, I'm like, what can you take off my plate?
Good.
So I was our director of education, and I was asked to sort of take on this more leadership role. I was like, I can't take on anymore unless you find someone else to do this other job, right? And so sort of having these limits. I also think that, sometimes I get to this point where like for example, I was on call over the weekend, but had to work like the weekend, and then the next week, right? As physicians, we often have to work weird hours and schedules. And I just realized that I am 46 years old and I cannot work 12 days in a row without a day off and still feel well, emotionally, physically, whatever. I need a day off to just like, whatever, decompress.
Yes.
And so I've made it like over the last year, very, very, conscious effort to, if I'm working over the weekend, I'm either going to give up one of those days to someone else or take a day off, right? Like, I really think you have to protect yourself from burnout. This is really a whole other podcast topic. And I'm sure, there's a lot of information about there, but there's a lot of, especially female physician burnout. And
Yes.
you want to be doing this a long time. You don't want to get burned out. And
Yes.
so when you're feeling that like agitation, or I sometimes I just get like little, I don't even know what agitated, I guess is the best word to say it. I'm like, I got to back up a little bit. And maybe I need to make more time for me to get administrative tasks done. Maybe I need to make sure I'm, rearranging my schedule. I think one of the biggest pieces of advice are, to get help, to outsource things that, like, especially at home. And I know you've talked about this on your podcast about sort of
Yes.
outsourcing the things that I know you've talked about, like having your husband make dinner and like all of these things, right? Like that is one thing. I do not make dinner. I also don't make my kids breakfast. I'm gone by the time they eat breakfast. But like,
Yes.
they're also old enough that they can do that themselves. But like,
I agree.
You're hungry? There's food in the fridge. You're old enough to make yourself a sandwich or a bowl of cereal. Yeah. But I have someone who helps get dinner on the table, right? And so I think those are some of the things that I think you have to be very thoughtful, and it's got to be very deliberate. Those things don't just happen, right?
And you'll sometimes get guilt trips. I will get guilt trips from my daughter, my youngest daughter. Well, blah blah blah's mom gets up at 4:30 in the morning to make hers. Well, you know how to make pancakes, and we made over. I will make them overnight oats or something, cheesy pudding the night before. There's that in the fridge. You've got yogurts. You've got this. You've got that. Healthy options. You can.
So guilt is a big thing, right? I number one, there's this whole mom guilt, and then I think being and I'm a full-time working physician plus run a practice plus trying to be a mom. I will tell you that I have had to you have to let that go.
Yep.
And realize that you're doing other amazing things, and if you're not there to like make their lunch, like maybe that's really important to you and that's special to you, go ahead. Make your kids lunch. For me, that's not something that I find valuable. I like to like take a walk when I get home with my kids. Like that's more valuable to me, right? I'd rather spend the time doing that than making their lunch. So I like, buy school lunch or have my, babysitter help make the lunch for the next day. Those are the things that like, you got to just like, let that go. You are like an amazing human being, balancing a lot of things. There's like no space in your emotional, bandwidth for guilt.
Absolutely. And I think what you said that's really important was just identifying what you find important, because it's different for everybody. For someone else, yes, making that lunch is important. For me, I think driving my kids to their activities is important because they're trapped in the car with me. So I really will make time for that. I don't want to unload the dishwasher or do the laundry, right? So those are the things. We all have differences in what we consider important and a priority for us. All right. What is one pinnacle pearl that you can share with our listeners?
So the best thing I would say is just to be kind to yourself. I feel like personally, I spent probably the first 40 years of my life, like just feeling like I wasn't enough, wasn't good enough, wasn't thin enough, wasn't productive enough, wasn't there for my kids enough. Like like I said, like this whole sense of sort of guilt, and just, I literally was like 40 years old before I was like, I'm enough and I'm doing all these amazing things and it's great. And I think that really just having grace and kindness to yourself, it's actually like, I remember feeling like there's no way I could be happy with what I'm doing right now. And I think a lot of us super type A personalities have this like vision of perfection that we want to be, right? And sort of just having that, learning how to love yourself for exactly who you are with all of your flaws, you don't have to be perfect, is something that I think really helped me get to the next level.
That's so good. It comes from years of experience, I'm sure, but something that I think everybody just needs to repeat probably in their head, no matter what. All right, Allison, where can everybody find you? Can you share all your links, your website?
So I'm on Facebook and Instagram and TikTok at dr.allison.rodgers, so dr.allison.rodgers. And my practice is fcionline.com.
I love it. Thank you so much for joining me today. This has been an absolute pleasure. Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.